Hello, and welcome to our COVID-19 update, where we'll be speaking to the Minister of Health, the Honorable Dr. Frank Anthony. Hello, Minister. Thank you for having us again today.
Thank you very much for having me on the program.
Okay, now before we start, can you provide a general update on our vaccination campaign so far?
Well, so far, as of yesterday, that is, we have 207,889 persons who would have received the first dose of their vaccines. That would be approximately 42.7% of our adult population who would have gotten the first dose. A second dose, those who have now become fully immunized, we have 73,471 persons, which represents approximately 15% of our adult population. I just want to remind people because we've been using three vaccines, AstraZeneca vaccines, Sinopharm, and Sputnik V. And for the AstraZeneca vaccine, initially, the time interval between first and second dose, we had pegged that at 12 weeks. We have now revised that guidance, and anyone between 4 weeks to 12 weeks can come to any one of our vaccination sites to get their second dose. So those persons who have received the AstraZeneca first dose, if you want to come a bit earlier than what the date that is on your card, you can come, because any time between 4 weeks to 12 weeks, you can get your second dose. So I want to emphasize that because a lot of people are waiting until the 12th week and then they come, but you can come a bit earlier if you like. In terms of the Sinopharm vaccine, those that we have given out, it's 4 weeks before you get your second dose, and we still see that there are a few people in different regions that have not come back for their second dose. So we want to appeal to persons who have received their Sinopharm vaccine to please come back and get your second dose, because without being fully immunized, you're not going to get all of the benefits of the vaccine. So we want people to be fully immunized. And with Sputnik V, we have received guidance from the Gamaleya Institute, that's the people who have manufactured the vaccine. And initially they were saying that you do the vaccine after about 4 weeks, the second dose. But now they have revised the guidance to allow vaccination anytime between 4 weeks to 12 weeks. And one of the things they're saying, if you delay the vaccination, you are going to see an increase in the durability of your immune response, meaning that your immune system, the antibodies would last longer in your immune system. So these are all good reasons why people should come and get within the stipulated time interval. So I just want people to know that. So we have a lot of people who have received their first dose AstraZeneca, and I think many of those would be due, using these new guidelines, would be due for their second dose. So if they come, we'll be happy to give them their second dose.
Okay, Minister, on the topic of vaccination, and we're well over about 3 months since we've rolled out the campaign, has there been any report of adverse effects?
We haven't had any adverse effects, and I want to distinguish adverse effects from side effects. Adverse effects is something that is really unexpected, and that's why when people receive their vaccines, we keep them back for about 15-20 minutes to observe them. One of the adverse effects that we normally will look for is anaphylactic shock, and so far we haven't observed anybody getting any of those things. And then we'll monitor people to see whether or not they develop any problems. Now, with the vaccines, there are going to be side effects, which is different from adverse effects or adverse reactions. So we have had people with side effects, and we have done a study using about 5,000 people in regions 4, 6, 7, 8, 9, and 10. And of those 5,000 persons, we have seen about 44.4% reporting side effects, which means that 55.6% did not have any side effects at all. Among the persons who reported, because we took samples from different age categories, between the 18 to 29 age group, you had 17.9% of them reporting some form of side effects. For the 30 to 39 age group, about 18.7%. For the 40 to 49 age group, we had 11.7% reporting. They had the lowest reports. And between the 50 to 59%, 59 age group, we had about 15% of those persons reporting a side effect. 60 years and above, we had about 36.7% of those persons reporting a side effect. Now, the most common side effect that people will report is that after vaccination, they will get a little bit of fever. So of those reporting side effects, 75.4% of those reporting side effects had a fever. 41.2% of those reporting side effects reported that they had soreness or a pain at the injection site. 37.2% reported that they had some muscle or joint pain. And 29.4% said they had a headache. 20.6% reported some level of tiredness or fatigue. 16% reported some chills, and 11.7% reported some sense of dizziness. And about 5.8% reported nausea, meaning they felt like they wanted to vomit. But all of these side effects went away within a 24-hour period. So we do see side effects, and it's a normal thing when you do vaccinations that you will have side effects. And we have been seeing that. But within a 24-hour period, these symptoms would resolve.
Okay, Minister, before I come off of the vaccination campaign, I know about more than 70,000 persons have been fully immunized against COVID-19. Out of that number, has there been anyone that has been infected with COVID-19?
Not that we're aware of, because once you're fully immunized, we haven't seen any of those persons reporting infection or being confirmed with a COVID-19 infection. We haven't seen any fully immunized persons coming into any one of our hospitals, nor, well, if they don't come to the hospital, then they wouldn't end up in the ICU, and nor have we had any COVID-19 related death with people fully vaccinated. So I think that's a very good reason why people should get vaccinated. On the other hand, almost all of the deaths that we have had in recent times, none of those persons have had their full vaccination. So that's something that I think people should think about.
Okay, Minister, can you please provide an update on the consignments of vaccines when Guyana is probably expected to receive some more?
We're working to get vaccine supplies. As you know, we're expecting another shipment of Sputnik V vaccines. Those should be coming in soon. And we have, as I would have told you before, we have paid to the African Union the monies that have been required for the J&J vaccines. So we're expecting those to also come in sometime during this month. We're expecting a shipment of AstraZeneca vaccines from COVAX, and again, those should come sometime during this month. And we're also expecting some additional Sinopharm vaccines, which again would be coming in this month. So we have vaccines from multiple sources that would be coming in at different points during the month. So as we have said before, we have enough vaccines for the adult population of Guyana. And we hope that people would come out and get their vaccines as quickly as possible so that we can all work to achieve herd immunity.
Okay, Minister, thank you for that. Through the U.S. allocation plan for vaccine dose sharing, about 19 million doses has been donated to COVAX in the first tranche. Is Guyana likely to benefit from this?
Well, Guyana, I'm not sure with the specific details of the U.S. allocation, but the U.S. would have identified, I think, 25 million doses, 19 of which they have donated through the COVAX mechanism. So all countries who are participating in COVAX, I think, would be a beneficiary of those vaccines. We, of course, are one of those countries that would normally access vaccines through COVAX. So, you know, more than likely we would get some benefits out of the donation. But the U.S. has also been working to do bilateral vaccination deals, and I think some countries would benefit from that. But we don't know the details of that as yet. So we're on the lookout to see how these vaccines would be allocated.
Okay, Minister. Now, I know the US has started to administer Pfizer vaccines to kids 12 to 18, and the UK had recently announced their intention to do the same. And in light of schools being reopened or scheduled to be reopened in September, has Guyana begun talks with the international partners in relation to having children vaccinated with using these vaccines?
So again, the vaccines that are being used in Guyana, which is AstraZeneca, Sinopharm, and Sputnik V, they haven't been enough clinical data for persons under the ages of 18. So unless we see clinical trials and data for these particular vaccines, then we would not use it for persons under the ages of 18. The Pfizer vaccine has been given emergency use authorization by the FDA in the United States to vaccinate persons below the ages of 18 in the United States and from 18 up to 12. And they have based those decisions on clinical trials that they ran with that subset of the population, and they found it to be safe. We and many countries in the world don't have access to Pfizer's vaccine. And we have made we have attempted to engage them, but unfortunately Pfizer cannot supply us because they have other commitments and markets in the near term. Maybe in some future point when they can make those vaccines available, then we can consider it. But as of now, with the vaccines that we have available, we are not using them in children until and unless there are clinical trials and data from clinical trials that would tell us that it's safe to use in children, because that would require dose calibration and a whole host of other things. So we are not there as yet. So what we need to do is, we know that this thing is safe and effective in adults, and we need to work to make sure that our adult population is vaccinated. Once our adult population is vaccinated, then we would, contain the virus in Guyana. It wouldn't spread, and you would protect yourself from getting the disease, and you would protect those around you from getting the disease. So let's start with what we have. We have vaccines right now that can be used in the adult population. There are still people who have been hesitant. We have to persuade those persons to come and get their vaccines, and once they get the vaccines, all of us would be much safer.
Yeah, sure. Thank you for that. Now, I uh, have a question, well, something I want you to comment on before we go. Yesterday, Parliament would have released a statement saying that members of the media would have to be vaccinated or present a vaccination card or negative PCR test before entering any building. Can you please comment on this?
I think, you know, many institutions in our country and globally have been looking at how they can keep people safe and the environment in which they work safe. And one of the things right now, given the context of the pandemic, is to try and make sure that persons who are visiting your work sites or to do business, that they're vaccinated. So we'll see more of this, I think, where people would be asking for proof that you have been vaccinated. And that perhaps might be one way in which people would be encouraged to go and get their vaccines. Because if all of us get our vaccines, then at some point there would be no need to show your card because all of us are vaccinated. But until we get to that point, I think people would want to make sure whoever is coming to them, coming to their offices and so that, you know, it's safe to do so. So, but despite that, we also have to maintain the other precautions, which would include wearing masks and also keeping the distance. So these things, again, until we are at a higher percentage of vaccination, we would not be able to let go of those common sense measures.
Okay, thank you very much for that, Minister, and thank you for your time today. This has been DPI's COVID 19 update. For more information, visit our website, dpi.gov.gy, or our social media platforms.